LASIK surgery seems like a quick fix for anyone suffering from near or farsightedness. But as more and more people are beginning to get the procedure done, they're starting to realize how it can ruin their lives. Our eyes are the windows to our soul, so why take a chance of breaking those windows by getting some kind of surgery that could potentially damage your vision? From the possibility of cornea slippage to severe eye dryness that might lead you to wearing goggles everywhere you go, here are 10 reasons not to get LASIK.
How's it going, guys? You ready for another awesome American Eye video? Let's check it out.
But first, in our Unbelievable Things Owned by the Rockefellers video, we asked you guys what else they might own, and we think Kevin Plowman here has a very valid answer to our question. Let us know in the comment section if you've ever gotten LASIK surgery and if you've noticed any of these problems. Do you regret getting the surgery, or has it been a life-changing experience for you? Give us your answer and maybe we'll feature you in an upcoming video. Number 10. Eyes are important. We use our eyes every single day of our lives, and we can often make assumptions about people just by looking into their eyes. With technology increasing each and every day, we need our eyes more than ever before for things such as driving, reading a screen, watching TV, and for developing a personal connection with someone. They often play an essential role when first meeting someone, and we can often tell if someone is attractive or not by looking at them for just a fraction of a second. Being able to see is often considered the most important of our 5 senses, and many of you would rather be deaf than go blind. A large part of our brain is dedicated to our vision, and our vision is really something we take for granted. But once it's gone or it starts to diminish, many people would rather give up on life altogether. Is it worth the risk to improve our vision just slightly so you don't have to wear glasses or contacts? We might have small problems that tend to bother us from time to time, but you'd realize that those all seem minuscule without being able to see. Number 9. The procedure. Would you feel comfortable having someone taking a knife to your eyeball, then shoot a laser through it? LASIK surgeons can perform up to 15 surgeries per day, and all it might take is one wrong move, and you could be in that 1% of people who are not satisfied with the results. First, the surgeon might give you a drug to calm your nerves so you can be ready for the surgery. Numbing drops will be applied to your eyes before to make the procedure as comfortable as possible and to decrease the urge to want to blink. The surgeon will then mark the cornea. First, a small flap of your cornea, or the outermost layer of the eye, is cut to create a small flap so they can get underneath it. This layer is clear and serves important roles in focusing your vision. The small flap is folded back, but remains on your eye with a little hinge of uncut cornea. A computer-controlled laser will then be employed to reshape the cornea to the correct vision. The flap is repositioned over the eye and remains intact by itself without the use of stitches. Number 8. Dry eye syndrome. After you get this crazy procedure done, you might experience some eye dryness. You might experience this for a couple of weeks or a couple of months, or who knows. Many people are pre-screened for eye dryness before they get to the surgery, so they can't blame the doctor if it starts to get worse. The reason it tends to happen afterwards is because some nerves in the cornea get cut, which can then reduce the corneal sensitivity. This might send the signals to your brain that your eyes don't really need any moisture because the cornea isn't sensing that it needs it. This results in fewer tears being produced in what's known as dry eye syndrome. Many doctors will suggest that you use eye drops since your eyes aren't producing them as much on their own. Some people are more prone to this syndrome than others, including females who've gone through menopause, those who take antihistamines and antidepressants, and also those who live in dry climates. Some patients have reported experiencing severe eye dryness that eye drops simply can't fix after getting LASIK. Number 7. 96% satisfaction. So, if about 96% of people are satisfied with their LASIK surgery, what about the other 4% who aren't? If roughly 600,000 people a year are getting the surgery, there's still 24,000 people out there who aren't happy with it. During the 1990s, the demand for this surgery was through the roof, with roughly 1.5 million performed each year. But now, as people begin to catch on that it's not all what it's cracked up to be, the number is down to be about 600,000 people. The doctors are seriously scratching their heads as the huge number drop off. Some blame it on the economy, while others believe the millennials prefer the trendy glasses look. Word of mouth seems to be having an effect on people, and the 4% are letting the rest of the world hear about their experience. This 4% that was surveyed claimed to have experienced symptoms to be anywhere from very to extremely bothersome. We'll get into some of the complications soon in this video. Number 6. Cornea slippage. Remember when we mentioned how the cornea over the pupil gets turned into a flap so they can laser underneath it? Keep in mind, it's not stitched up or anything, and that flap is going to be there for life. The cornea doesn't completely heal itself after LASIK and can actually be dislodged at some point during the person's life. Now imagine you're playing a game of basketball and someone accidentally pokes you in the eye. You might as well kiss your corneas goodbye. The FDA warns that people who play contact sports shouldn't get LASIK surgery done just because of this reason. But even if you don't play the sports where you might get poked in the eye, it's something that will forever be following you around, and you just never know. What happens if a girl at the nightclub has long fingernails and pokes you in the eye with your cornea hanging on by a thread? LASIK permanently weakens the cornea, and several years down the line, you may regret the decision. Number 5. Long-term consequences. There are quite a few unrealistic advertisements out there that will lead you to believe that you can just throw away your glasses and contacts immediately after getting surgery. Don't throw them away just yet, folks. Many people will still claim that they have to use their glasses. FDA clinical trial data shows that 1 in 5 people will report that they still need their glasses either way, and even the most modern laser technology left them seem worse than before. Research has also shown that people who've gotten LASIK will develop cataracts 6 years earlier than most people on average. Part of this is due to the steroid eye drops that are prescribed immediately afterwards. Corneal keratinocyte density tends to decrease after surgery, which can lead to post-LASIK ectasia. The true rate of LASIK complications is hard to determine precisely since not everyone will report it. They also might be dealing with night vision impairment and dry eye symptoms and not thinking anything of it. Number 4. Doctors don't listen. A woman named Paula Kofer that we see in this photo is an unhappy LASIK patient, and she's wearing moisture-retaining glasses to protect her eyes now. She stated that LASIK made good sense at the time. Not having to deal with the hassle of glasses and contacts was quite appealing. But 10 years later, she suffers from severe eye dryness and blurry vision. She stated that her eyes burned all the time. She used eye drops, eye rinses, eyelid scrubs, and has to wear these glasses more often than she'd like. Seems to kind of defeat the purpose of LASIK in the first place, right? She can no longer drive because her vision is too blurry. In some severe cases, the pain is so extreme that unhappy patients will have an implant inside their body which will release a painkiller known as fentanyl immediately into their blood system. Number 3. Downplayed risks. Of course, all the doctors would have told her that it's a totally safe procedure and they do it all the time. Heck, the doctors could probably perform the procedure while they're sleeping because it's so easy. Everyone is so pleased with the results and nothing could possibly go wrong, right? The doctors would simply say that people like Paula Kofer weren't good candidates for LASIK in the first place because she had large pupils and her eyes were already dry before she got it done. The doctors will tell them that the surgery will make them glasses free and they might only need glasses when they're reading occasionally. If that's the case, then how come so many doctors out there won't actually get the surgery themselves? What about the 11 recorded suicides that have taken place where the victims left notes about how LASIK ruined their lives? Jen Starr, one of the more recent victims of LASIK, left this tweet before her life was tragically cut short. She had been struggling after her surgery left her in immense amounts of pain and discomfort before she eventually just gave up. Number 2. Visual complications. Things start to get a little bit complicated when visual complications start to arrive. If you thought your vision was bad before the surgery, you might be in for a big surprise about the reports of vision problems that can occur after. In a published review of data by the FDA, it stated that 17.5% of people reported seeing what's known as halos, and these things don't come from angels. This photo here displays what a person might see after getting LASIK, where there's a glare that comes from a bright object. But that's not all. 19% report having problems driving at night because of the bright lights and other visual disturbances. How comfortable would you feel driving on the same streets as someone who's in denial about having a faulty LASIK surgery? Vehicle fatalities are already 4 times more common at night than at daytime, adjusted for miles driven. Many testimonies from unhappy LASIK patients will support that driving at night can be a serious issue. And number 1, recovery options are limited. LASIK surgery is irreversible and kind of like a bad tattoo. If you don't like it, you're gonna have to try to live with it the best you can. One of the options would be to get post-LASIK hard contact lenses, which are also uncomfortable and defeats the reason of getting LASIK in the first place. The last resort option would be to get a corneal transplant, which doesn't always work and is likely expensive. This type of surgery is required for people who have corneal injury, severe corneal scarring, or LASIK-related problems. The most common in regards to LASIK patients include ectasia, cornea infection, flat melt, or severe irregular astigmatism. Healing from this procedure takes up to a year to finally recover, and there's no guarantee that it actually works. Vision after the corneal transplant might still be poor, and you might even be left with a scar on your eyeball from where the donor tissue was removed. So watch out.
Hey guys, if you haven't noticed already, we're almost at 1 million subscribers, so remember to smash that subscribe button.